other times like bloated stomach. I felt like 9 months pregnant, and I was nauseated a lot. So that really changed with the diet now. Blood flat, I don't have the blowing no more, and I have more energy, and my appetite got kind of less too. You eat less.
Have you lost weight?
Yes.
How much weight have you lost in your life?
About 6 pounds.
Yeah. And you've been in the program how long now? I've been in the program.
And I've been in the program now 2 weeks, 3 weeks.
6 pounds in 2 weeks. Very good. All right.
Before I started the wellness program, my blood pressure was up. That was one of my concerns. And my diabetes, I was taking insulin. And my weight, I was at 322 pounds. And now I've got myself down to, this morning was 295. So for me, with this program, I see that I can take little bit steps at a time, and my goal is 5 pounds at a time. 5 pounds till I reach my goal of somewhere around about 200 or 220. That's my goal. I was taking insulin for my diabetes. I was able to come off of one of those, and my blood sugar level has dropped in the 100 zones. Before it was like in the 150, 160, but I feel comfortable keeping it at like 100, 108, 95. I don't have to, better now. Energy level is increased. Now I gotta find what to do with the energy level. So I have a stationary bike that I have a chance to work out on it more. And I started out with 10 minutes on it. Now I'm up to 25 minutes on it because I got more energy. And
How long have you been on the program now?
It's been about 3 weeks. It's been about 3 weeks.
Sure.
Since I've been in the wellness program, I've found that I've lost at least 1 size.
Wow.
And I do have a lot more energy, and I'm able to do some things that I wasn't able to do for a long time. I feel better. I don't have as much pain. The arthritis isn't bothering me. Less swelling. Yes, I am glad I joined the wellness program.
Before the wellness program, I was having boils on my upper thighs, a lot of pain in my back when I would garden and do my home renovations. And when my menstrual cycles, it would be like having labor every time. So having to take medicine for that all the time.
Wow. Were the medications helping?
They would help to a certain point, and then you'll have to take more because the pain will come back. Mm-hmm. Yeah. Since the wellness program, my menstrual cramps had gone down a lot. The boils, I haven't had them at all in the 2 months. And when I'm working in the garden, no back pain. When I'm doing home renovations at my house, I could be working 4 or 5 hours, no back pain at all. Wow. So I really enjoy that. Recommending the wellness program to everybody. And when I'm at work, I'm telling people, stop drinking that soda. So, yeah.
Before I started the wellness program, my body was sluggish. I was tired all the time. I carried excess weight I just couldn't get rid of, and I just felt not energetic. Just didn't have any energy to really do anything.
And then after you started?
After I started the wellness program, I was kind of skeptical. But then, as I progressed in the program, I started the detox program, which really started everything, and I lost weight, started to eat better, start feeling better, more energetic. Overall, I lost about 30 pounds, and My energy levels is better. I sleep well at night. I get 8 hours of sleep finally. That helps. And I'm just more conscious about my intake and, you know, what I eat, and, you know, I feel just generally on a scale of, you know, 1 to 100, I'm like 95% more improved physically, mentally, and overall, my overall health.
Thank you guys very much for taking time out, because we're going to concentrate on your health. And not only are we going to concentrate on your health, we're going to concentrate and focus on your life. Because if you don't have your health, what do you have? Exactly. And in this time, I'm going to, you know, it's not going to be a presentation. I'm going to have a conversation with you. Is that okay? So I'm going to get comfortable. I'm going to unbutton my coat here. It's going to be, and we're just going to be real. I'm going to dispel some myths out there about your health. I'm going to talk to you about how the system is not on our side when it comes to wellness. I'm going to share how we can reverse some of these chronic disease processes. But not only that, we're going to share with you how you can take some steps starting tonight and move forward in order to improve your health. Is that okay? Now first I'm going to get rid of this huge gorilla sitting in the room. You guys know what that gorilla sitting in the room is? Well, this is it. How many of you guys, when you got the invitation or saw the invitation and everything, you thought, well, what is he selling? How many thought that? I mean, hey, I do this week in, week out. I'm doing this. And I do it because I have a passion for teaching people like yourselves about what's going on with your health. So, it's okay. How many thought, what is he selling? Raise your hand. Might be honest. It's okay, great. Now, I am going to sell you something. And this is what I mean by I'm going to sell you something. As far as in this time, I'm going to be before you for about an hour. And in that time, I'm not going to be able to share with you everything in order to improve your health. It's impossible. And not only that, I'm going to share a lot of fantastic information with you. But the truth be told, does information alone improve your health? No, it does not improve your health, because if it improves your health, we'd all be healthy. There's so much information out there about improving our health, improving our life, we'd all be healthy. But what do we have to do with the information? Yes, Dave, you hear Dave? Excellent answer. You have to act. We have to act on the information. We have to correctly apply the information to our lives in order for it to work for us. So I'm going to help build a blueprint for you to get from something that's unacceptable in your health to where you really want your health to be. And that blueprint will help you figure out how does it apply to me individually. So in that time, it's not going to be fair for you to think we're going to be able to do it. So because we're not going to have time to do it all, I will afford an opportunity for you at your permission. I'll get your permission that those of you who want to take a step further and partner with us and move forward and improve your health, improve your life, we're going to provide that opportunity to you. Fair enough? Fair enough. Fair enough. So that's how that gorilla's out of the room. But quite frankly, it's going to make sense to the majority of people. When it makes sense to you, it makes sense. Take the next step, move forward, get your health, get your life in order. If it doesn't make sense, and for you, it may not make sense. And if it doesn't make sense to you, I'm not going to try to twist your arm. I'm not going to persuade you to do anything. Because if it doesn't make sense, it's not going to work for you, and it's not going to work for us either. And we'll just have a good dinner and call it a night. Great? All right. So let's get back to our lives. You guys are, I'm assuming you guys have come here for more than information, but that you need some help. Am I correct in that assumption? You need some help. Okay. But you're looking in order to maintain your health or prevent some problems or reverse some things. Am I correct in that? And I talk to these audiences, like I said, 6, sometimes 8 times a month, because I have a passion for helping people improve their lives. Too long we've been lied to, and we haven't had the correct information in order to take steps. Now, I'm talking, the title of the talk tonight is as far as hypertension, diabetes, and obesity. So how many guys out there have diabetes? Diabetes? Okay. How many have high blood pressure? How many have obesity or some weight that you didn't really want kind of going around? Right? How many have high cholesterol? High cholesterol? Was that? It's up and down. Up and down? Ah, so not as good as you think. So, and the thing about this, a lot of times when you go to your health provider and you have some kind of chronic disease like the ones we've just mentioned, and they put you on a medication. Everything okay? Great. So you put you on a medication. And when they put you on the medication, how long do they tell you you're going to be on the medication? For the rest of your life. For the rest of your life. That's what I mean, oh, you're going to be on this for the rest of your life. And that's a lie. That's a lie. You have choices. And we're going to share with you how to reverse some of those things. You've seen some of those testimonies from some of our current clients. Some of you even among here may have to reverse some things here when it comes to chronic diseases. And we're going to help share that with you so that you have a choice when it comes to your health. How many of you guys, if you thought about it and you said, you know, is America getting sicker, or is America as a whole getting more healthy? Sicker. We all agree that America as a whole is getting sicker. And how many of you guys would like to avoid becoming sick, fat, and generally depressed? You want to avoid that? You want to avoid that? Great. Now, there's one other thing I want to do. We're going to do a little exercise, okay? This is a participation exercise. Everyone raise your right hand. Wave it up at me. Okay, all right, got you, I understand. Left hand? Great. So at least everyone in the room can do at least one hand. That's good. So when we ask for participation, I want to see those hands. Great? All right. Now we're talking. Now we're talking. Let's look at our health. We're on a journey. And those of you who may not have raised your hand when it comes to having any of those chronic diseases we mentioned, but the people who raise your hand, you're in the right spot. And those who are support, you're definitely in the right spot as well. And this is why. Because I believe that we're all here, put on this earth at this time for a purpose. Do you guys believe that? And we're able to fulfill that purpose when we are healthy, when we're feeling good. When we're sick and don't feel good, we're less apt to do certain things. And when I talk to clients and people just like you, we're all typically about the same age, typically in the upper 30s and higher. And we're in that time of life when we realize we're not going to live forever. And because we're not going to live forever, I help share with people how in the 20, 30, 40, 50 years we have left, we can live it abundantly. And not just abundantly, but be able to fulfill those things. Because when we get to this age, when our kids are maybe out of the house is maybe paid for, most people should be fulfilling those things they really want to enjoy and do in life. But too many times, they're too sick to do it. And society, the system, has told you, oh, you need to be on this medication, and you need to be on this medication for life. And you know what? The medication in and of itself sometimes, most of the time, causes problems. What kind of symptoms are you guys having? Arthritis? What other symptoms?
Trouble sleeping.
Trouble sleeping. That's a big one. Heartburn. Being tired. And all of these are signs and symptoms of chronic disease processes. And sometimes we blow right through those signs and symptoms until we come down with a disease. Or worse yet, a heart attack, stroke. And most of the time people go back into the same thing they were doing before. Why is this? Well, the system is broken. The healthcare system in America is broken. Like I said, I am going to be real with you. I'm not going to talk doctor talk to you. I'm going to explain things to you and dispel some myths and help you open your eyes and take charge of your health. Because who should be in control of their health? Exactly. We each should be in control of our health. Okay? Thanks, Josh. Okay? So, all right. This is the deal. When we have these chronic problems going on, and we see that there's things, we're just not able to do the things we enjoy doing, or we slow down a little bit, or we have aches and pains, or we're not able to sleep adequately, those are telltale signs that something's going on. And if we don't take heed and pay attention and correct the underlying problem, things get worse. Let's look at our system. Do you guys believe that America is in a healthcare crisis? Why do you think we're in a healthcare crisis? Why do you think? Someone in back table. Why do you think we're in a healthcare crisis? Yes, Russ?
The biggest problem is people get a certain age and they stop doing everything.
Well,
all right, the majority of stuff.
Yeah, but the thing, Russ, when people get that certain age and they stop doing things, it's typically because in life, we've made some choices early on. And those choices that we made early on are starting to catch up with us. And we can choose our choices, but we can't choose the consequences of the choices. But you guys are here now, today, and you can make a change for the better. Because if you're headed down a road and you don't like where that road is taking you, what do? Change the road. Change roads, turn around. Exactly. This is why the healthcare system in America is not working. Now, we do a great job when it comes to acute problems. Those are short trauma, short things. We do a great job. But when it comes to chronic problems, we do a lousy job. And this is why. Let's say that everyone in America smoked cigarettes. Everyone in America smokes at least 3-4 packs of cigarettes a day. What disease do you think would be prevalent? Lung cancer, emphysema, COPD, exactly. So those would be prevalent. And you know what the healthcare system would do? Oh, well, these diseases are a problem. So they would develop all these medications to deal with the lung cancer, the COPD, the emphysema, and they pour money, so much money into those diseases. And in medical schools and in other provider institutions, we learn how to take care of the disease. But we don't learn how to fix the underlying problem. Why not you help people not smoke in order to prevent the disease? That's where America, we lead almost the world in how much we spend per citizen on health care. But we do a lousy job with these chronic problems because we're focusing on the wrong thing. We're focusing on the disease versus focusing on wellness. Let's look at the system. We've been lied to. We've been lied to. One of the lies we just talked about, oh, you're on this medication for life. That's a lie. That's a myth. The other thing, it's all about money. And whose money? Our money. Your money, my money, our money. Have you guys heard of the Affordable Care Act? Is it affordable? No, it's not affordable to us. It's not affordable to the majority of people. But who passed it anyway? Who passed the Affordable Care Act?
We have to pay for medical care. Senators, they don't pay.
Senators, congressmen, the government passed it. And why did they pass it? They passed it because of insurance companies. So the system involves the government, and then it involves insurance companies. And we're going to talk about the insurance companies and why they wanted this passed, because it is affordable to them. You guys all agree America's getting sicker, correct? I agree. We're talking about diabetes, high blood pressure, and some other things. What percent of the United States population do you think right now today have type 2 diabetes? We got 40 over here. 45. Michael says 45. Cynthia says 75. Do we have 80? Do we have 80? Do we have 90? Do we have 100? Well, the truth of the matter is, right now today, 9% of the population in the United States have type 2 diabetes. 9. Oh, wait, hold on. Hold your questions. Hold your questions, because I have a lot of information, and some people, this is their last hope. So I want to make sure I get, and I guarantee you, I am going to answer the majority of the questions in my talk tonight. And I want to make sure that, does anybody have a hard stop? You got to leave, like hard stop tonight? So we're here. We're here. Let's focus on our health today, right now. So with that 9% of the population having type 2 diabetes, over 25% of all Medicare dollars are spent on type 2 diabetes. They're projecting that in the next 20 to 25 years, that over 33% of the population will have type 2 diabetes. So if 9% of the population today have type 2 diabetes and a quarter of Medicare dollars are being spent on type 2 diabetes, how much do you think is going to happen when 33% of the population have type 2 diabetes? The system cannot sustain itself. Because insurance, believe it or not, health insurance, they want you sick. But they don't want too many people sick at the same time. That's why the Affordable Care Act was passed, and they twisted people's arms that were healthy to force them to get insurance. And not only that, how many people had their premium go up in the last couple of years? Or their deductible go up, or their out-of-pocket expenses go up, or if they cut back on some of the things they used to cover. They're trying to cut their losses because they see that road, and the road's not pretty. I'm going to help you guys avoid being in that crisis. So we've been lied to when it comes to our health. So we have the government, we have insurance companies. Look at this, you guys heard of Medicare. Care that seeks to prevent disease, promote health, and prolong and enhance the quality of life is not considered medically necessary. That's a quote from Medicare. What does not medically necessary mean?
You're not going to pay for it.
Yes, Debbie. Excellent answer. That means we're not going to pay for it. Because, once again, they don't want you well. But they don't want you dead either. They want you in that quasi state where you have to go back to the doctor's office again and again and again. Let's look at insurance. Who here has auto insurance? Auto insurance? When does auto insurance pay out? If you have an accident. Yes, Jewel. If you have an accident, it pays out. If you're a great driver and never have an accident, never have a claim.
Then after so long, you raise your premium.
Right. Now, but if you never had an accident, yeah, that's good. What about homeowners insurance? When does homeowners insurance pay out? When something happens. What about life insurance? When does life insurance pay out?
After your life is over.
When you die?
Yeah, when your life is over.
Why don't they call it death insurance then?
It's scary for some people.
Yeah, death is scary to some people. So they don't want to call it death insurance because that's scary. But you know what? We're all going to die. I'm going to help you fit the information you know apply it to your life, build a blueprint for you so that you live an abundant life, and guess what? When it's time to die, you die. Versus you get a disease, you get an impairment, you can't do certain things, you slow down, you withdraw from your family, you can't participate in things you like to do, you're not able to travel, you can't do much because you get short of breath, you're tired, and then over a number of years, you die. We want you to be able to live abundantly, fulfill your purpose, and die. And that's okay. Death insurance. Now let's look at health care insurance. When does health care insurance pay out? When you're sick. So why don't they call it sick insurance? Once again, it doesn't sound too nice. So I want to help share with you, and you need insurance for catastrophic problems, but every time you go for minor issues when you're sick, they're just charging your insurance and they cut you off and make you dissociate yourself from your health, and they pretend like they're taking care of you, and they're not. How many of you guys believe your health is worth investing in? Your health is worth investing in. 90% of all diseases prevalent today are not treatable with orthodox medical practices. What are orthodox medical practices? Pills. Jewel hit it on the head. Great job, Jewel. Pills. Pills are orthodox medical practice. When I went to medical school, just like a lot of other young aspiring physicians, physician assistants, nurse practitioners, we go there wanting to help our clients, wanting to help people. But you know what happens when we get to medical school? We get indoctrinated. We get indoctrinated to push pills. Because who underwrites most medical schools? Pharmaceutical companies. Pharmaceutical companies. And what do pharmaceutical companies want to do?
Sell pills.
Sell pills. So they focus on, once again, the disease, they focus on the symptom, and they don't fix the underlying problem, because if you don't fix the underlying problem, you have to come back. Those of you guys who have high blood pressure, those who know someone with high blood pressure, and they're taking a blood pressure pill, does that blood pressure pill push your blood pressure down?
No.
It fixes the number, but does it fix the underlying problem? Because if you stop taking the pill, what happens to your blood pressure? It goes back up. And who do you need to see to get that prescription? The doctor. And the doctor gets it from the pharmaceutical company. How about, if Brooke has high blood pressure, her reason may be different than Donald's, which may be different than Dave's, which may be different than Sherry. You have to figure out what the underlying problem is, correct the underlying problem in order to fix the problem, to get better, to correct the dysfunction. The other thing that helps, that's part of that orthodox medical practice, is surgery. Now, 10% of the things that we do great. You have a urinary tract infection, here's an antibiotic, take care of it. If I'm in an auto accident and I lose my arm, take me to a hospital, because we do great with trauma. They'll put my arm back on, it'll probably even work again. But when it comes to chronic disease processes, we don't do so good. For instance, someone have a stroke. You get them in the hospital in time, we give you a clot buster, take care of the stroke, you have no deficit, but they go back and do the same thing they were doing before that got them in the predicament in the first place. And then they have a second stroke and a third stroke. Oh, but here's another medication. So do medications work? Sometimes, but for the majority of problems, not really. So we have the government, we have insurance companies, and we have pharmaceutical companies. And all of us, to include your healthcare provider, we get thrown into the system. And well-meaning people who want to help others become indoctrinated, because that's what we're taught to do. until someone says, wait a minute, this is not working. Why isn't it working? What disease is this talking about? Severe allergic reactions, difficulty breathing, swelling of the mouth, chest pain, muscle pain, frequent urination, stomach pain, diarrhea, swelling of the hands, increasing blood sugar, yellowing of the eyes or skin. What disease is that?
Side effects of any medication you take.
Oh, wow. You guys heard Jewel? That is an excellent answer, Jewel. That's a side effect of a lot of different medications. So why would you take one of these things? As a matter of fact, that's the side effects of atorvastatin. And most other statin drugs. But guess what? If you have diabetes, you have diabetes, you need to be on a statin. You're on a statin, what's it? Increasing blood sugar? You have diabetes already. So you're on to the game now. You're on to the game. This is from the World Health Organization. Back in 1995, they realized that cholesterol is not the problem when it comes to heart disease. It's the inflammation of your blood vessels that's the problem. The inflammation of your blood vessels is what causes the blood vessels to be sticky, which causes the clot to form. It's not the cholesterol. Cholesterol is not the problem. It's the inflammation. And what causes inflammation? Blood sugar causes inflammation because of stress. It's a chemical stress on the blood vessels. Stress causes most chronic diseases. That stress can be physical, chemical, or emotional. They all act in our body the same way, and chronic stress causes inflammation. That inflammation can manifest itself in a lot of different ways. We have the wrong or lacking information. We have the wrong or lacking information. And this is why. Have you guys ever been walking down like a path or something and get a rock in your shoe? Does it feel good? No, it doesn't feel good at all, does it? And when it doesn't feel good, how many of you guys think, I'm going to go home and I'm going to take some ibuprofen or some acetaminophen? No, that's absurd, right? What do? You stop and you take the rock out of your shoe. You fix the underlying problem. But let's change it around a little bit. How many, when you have a little bit of heartburn, a little acid reflux, how many think, I need some Tums, Rolaids, Alka-Seltzer, Nexium, Prilosec, Zantac, Prevacid, Protonix, yada, 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 on and on and on. Versus thinking, maybe something's not quite right. Why am I getting this heartburn all the time? What's the underlying problem that needs to be fixed? It's because we have the wrong or lacking information. And where do we get that information from?
From the people who are supposed to know.
We get the people with doctors. And I'm not beating up on doctors. I'm one of them. But we learned it from medical school, which was underwritten by pharmaceutical companies who want to push medications. They're part of, like I said, we're thrown into the system. And unless we get the proper information and the blueprint to get out of the system, we'll remain in it. Have you seen this contraption? What is this contraption for? Abs, helps your abs, okay? So you get this contraption, somebody might have a little belly fat. You got a little belly fat. You get this contraption because you see this nice studly guy, rock hard abs, or this nice beautiful young lady, and you say, I want to look like that. And so you get this contraption, and you have this belly fat, and you start bending your belly fat, and you crunch your belly fat. How many times do you bend your fat before your fat goes away? It never does, because bending fat does not make fat go away. But they sold tens of thousands of these because of marketing. Because of marketing. Here's another, you guys know you're on the game now. Here's another side effect deal here. Abdominal cramps, diarrhea, constipation, low blood pressure, wheezing, decreased sex drive, impotence, difficulty having an orgasm, high blood sugar, lightheadedness, fainting, loss of appetite, easy bruising. What is this one describing?
High blood pressure medicine.
Excellent answer. Metoprolol, Toprol.
Just heard about that 3 weeks ago. That's amazing.
So a lot of times people who have high blood pressure, they may develop diabetes along the road. And the medication might be causing it. But once again, that inflammation process is also there. That's going to cause a problem. And we're going to help you get out of this cycle. Get out of the system. Are insurance companies here for your wellness?
No. They're here to make money.
They're not here for your wellness. What does this plant need?
Water.
Water. You guys almost said that in unison. Water. Plant needs water. What else does it need? Cynthia said Miracle Grow, some good nutrients. Brian said TLC, tender loving care. But you know, my grandmother, she had a green thumb, Brian, and she said you have to talk to the plants. And guess what? Her plants are always beautiful. Always beautiful. I hear sunlight. Plant needs sunlight. Carbon dioxide. Needs some carbon dioxide. You give that plant some TLC, some water, sunlight, good nutrition, some carbon dioxide, it perks right up. It looks beautiful. Notice that not one of you guys said that this plant needs a medication. So why is it that when we have a problem, we're looking for a medication? So let's say we give the plant what it needs, it perks up, it does well. And as it does well, unbeknownst to any of us, someone comes in the middle of the night and starts pouring in motor oil into the plant. So not only do we need to give it what it needs, we need to remove what it does not need. So that's called not being proactive. A lot of times people, we're in this crisis because we're not being proactive, we're being reactive. We wait till something happens before we try to correct it versus preventing the problem from the start. A lot of times clients come in my office and I'll talk to them and I'll share with them and I'll ask them, well, what are you doing for exercise? And they'll say something like, I'm walking the dog. Great, you're walking the dog. How far are you walking the dog? Well, I walk the dog every day. Great, you walk the dog every day. How far are you walking the dog every day? And then they'll say, I walk the dog a block. Okay, that's living, that's activity, not exercise. Activity is better than no activity, but not exercise. So make sure you get the proper exercise. Sometimes I get something like this. So what do we have to do with information? Use it. Use it and apply it appropriately.
The treadmill works just as good and don't burn gas.
So being proactive, that's what we're all about. We talked about being proactive versus reactive. Why do we get the results we do? We get the results that we do because we help people find out what the underlying cause of the problem, and we help them apply the information correctly and how it applies to them, because everything that might be good information might not be right for each individual. Who's heard of this guy? Who's seen this guy here? What's his name? Jack LaLanne. I bring up Jack LaLanne because Jack LaLanne, he was an excellent coach and mentor. Have anybody had a coach, a mentor, teacher? And Brooke, when you had that coach, why did you have a coach, mentor, teacher?
Well, I have a trainer because I'm not going to exercise without her.
You have a trainer. The trainer, the coach, mentor, they teach you some things that will help you develop in the area that you want to develop. So as a physician, I think it's a physician's role to be your health coach, so that you understand and how to get to your health goals. So So, Matt, do I have your permission to be your coach tonight? Yes. I have your permission to be your coach tonight? Yes. So we're going to share with you, and I have a coach, because I don't know everything. I have a coach, because I want to continue to develop, and as I develop, I'm able to bring others with me in their health journeys. Jacqueline, this is Jacqueline in its heyday. That's no artificial anything. That's all natural, no steroids, that's all natural. That's Jacqueline in his mid-80s. Look how chiseled he is, in his mid-80s. So we take the sword off the table when you say, oh, well, I'm too old for that. All right, everybody take a deep breath. Let it out nice and easy. You're breathing, you're here, you're not too old. You're not too old. There comes a decision on, do I want to improve my health? Do I want to be able to fulfill my bucket list and do those things with my kids or my family? That's an important thing, and that's what separates us, because we teach people how to do that. If you had a mentor, the mentor can help you avoid some things, and you can spend as much time, money, and effort that I did to earn my degree in order to get the help you need, or you can take a shortcut and learn some things from me to get you where you want to be. What's the smarter approach? Do the shortcut. Exactly. Let's look at some complications of diabetes. Weight gain. Because a lot of the medications, weight gain is a side effect of some of the medications. If you're not as active as you used to. What are some other side effects of diabetes?
Neuropathy.
Neuropathy. You guys heard of neuropathy? Yeah. Nerve damage. What else? Eyes. Eyesight. You go blind. Some people go blind because of diabetes. Kidney disease. Yes, Debbie. What else? Heart failure. Yes, Marianne. Heart failure. We'll have somebody in the back table. Participate, please. What are the complications of diabetes? Death. Yes, Gilbert. Death. A lot of times, hold on, we're going to hold on this death thing. A lot of times on the death certificate, it may say cause of loss of life is heart failure, respiratory failure, but the underlying condition was diabetes. So death. I mentioned amputation, another side effect. What else?
That's what I was going to say,
amputation. So you guys, what's that?
Liver disease.
Liver disease. And the liver disease come from a lot of the toxic medications that we're taking. Yep. So you guys know these complications of type 2 diabetes, and the thing is, if you have high blood pressure or high cholesterol, you can have some of the same complications because the same inflammatory process may be going on, it just hadn't affected your blood sugar yet. Neuropathy, peripheral vascular disease, your vessels, it affects all of your blood vessels. Eyes, blindness, heart attack, stroke, burden to your family. Because when you make choices and you don't take care of yourself, you're not able to fulfill the purpose you have. And not only that, it affects who?
Family.
It affects everyone. So you may be saying, well, my health is my problem. My health is my problem. If you got married, it became someone else's problem too. If you have kids, it became someone else's problem too. So it affects everyone. And our loved ones love us, but if we're making choices that's going to impair us down the road, even though they may love us, Aunt Sally, she's starting to get in the way a little bit. Loss of life, death, a real problem. Allison, I bring up Allison. Allison was a fantastic young lady. I mean, just fun-loving, great smile all the time, just beautiful. Back when we were young, we used to play together all the time. Her brother Chris, my brother Andre, we'd get together in the summer, just play all summer long. Yes, summer's always short, because we just have a great time. And Allison was my cousin. she hung around with 3 boys. But Allison was an athlete. If you had any sports team, you'd pick Allison first because she was that good. Her favorite sport was baseball. And Allison was she was like a cousin you just always want to be around, just always fun-loving and jovial. Well, we graduated from high school. I went off to college. She went to beauty school. Because even though she was an athlete, she always kept her hair perfect. Always perfect. And she enjoyed that, and she enjoyed helping other people bring out their beauty. And she became a beautician, doing well, and then later on, she met the guy of her dreams. And when she met him, they fell in love, they got married, beautiful couple. He enjoyed baseball as well, and they go to see the Atlanta Braves. That was the closest professional team to us. We were in South Carolina. And just wonderful. Well, as time went on, I found out that Allison had developed type 2 diabetes. Like, wow, Allison, come on, Allison, type 2 diabetes? And when I was in school, you know what they taught us in school? That only old fat people got type 2 diabetes. But at that time, that was the majority. But now it's not so. We're seeing more and more young people get type 2 diabetes, more and more thin people get type 2 diabetes. And we're going to share why that's happened. So Allison developed type 2 diabetes, and then later on, my mom called me. And my mom says, hey, Allison was in the hospital. I said, what happened? Well, she had her leg amputated. And when she had the amputation, it was above the knee, not below the knee. And you know what her insurance company said to her? A prosthesis? That's not medically necessary. And what position do beauticians work in? Most of the time they work standing. Most of the time they work standing. So it cut into her livelihood, cut into what she enjoyed doing. Definitely had an effect on her psyche. Now, she was a beautiful young lady, but having an amputation, she didn't feel as beautiful as she really was. Her husband continued to love her, but you know, they weren't able to go and enjoy as many baseball games because it's really kind of hard traversing stadium seating in a wheelchair or on crutches. They were a 2-income family. Now they're down to 1 in a little bit. And she continued to be, nice person and happy. But as time went on, my mom called me again and said, Allison died last night. She had a heart attack. Complication of diabetes. It's a real thing. And she was young, very young. She didn't get to have the family she was looking to have. Now you may be sitting here thinking, well, I don't have type 2 diabetes. I don't have high blood pressure. But there's some telltale signs that inflammation may be going on. You're not able to be as energetic as you used to be. You may not have the mentality. You might have a little brain fog a little bit. You may be getting a little pudgy around the middle. Your blood pressure may be out. Your cholesterol may be out. And medications aren't the answer to fix the issue. If Allison were here tonight, do you think she would do some things differently? You betcha she would. But you guys are here tonight. You have a choice. You're going to stay here and do the same thing you've been doing before you got to here tonight? Or you're going to make some changes and get better? Why do you want to be healthy in the first place?
Enjoy life.
To enjoy life. Yes, Michael. To feel good. Yes. Vacation. Travel. Travel's much more fun when you're feeling good. You have to figure out why. This is my reason to be healthy. That's my wife and son. And I believe the picture's much better when I'm in it. And I plan to be in it for a very long time, and not just in it, be an active participator in their lives. Why are you? That's the important thing. What is it to you? Why is it to you important to be healthy? And grab hold of that, and we help you get to your destination when you're in this unacceptable position. Food. Purpose of food. That which is eaten to sustain life, provide energy, promote growth, and repair tissues. Most of the time, most things people are eating is not real food. It's food substance. And the difference is it doesn't give you the proper building blocks to repair your tissue correctly. And when your tissue is not repaired correctly, you continue to degrade over time. Let's talk about some myths of diabetes. 1, diabetes always gets worse. Myth. You can reverse diabetes. According to the Centers for Disease Control, diabetes is preventable and controllable, and it is reversible. It is reversible. So if you're on some medications, you can take charge, learn the right tools in order to reverse it. Myth number 2, diabetes is genetic. You just have to learn to live with it. Myth. They've done many studies with twins, identical twins. One twin lives one way, the other twin lives the other way, and the one twin that lives well in a good environment does well, and they have the same genes. Over and over again, it's been proven. So you can't blame it on genetics. Only about 3% of diseases are genetically controlled. 3%. Diabetes is definitely not one. High blood pressure is not one. High cholesterol, for the most part, is not one. Because who do you live with growing up?
Your influencers.
Your influencers, your family. And you tend to do the same things that they did. As long as you take your medications, diabetes is not a big deal. That's a myth. Oh, what did they tell you your goal for your hemoglobin A1C? What's the goal?
Below 6.5.
Below 6.5 or 7 for a diabetic. You can have a great, your control is great, but you're fixing the number, you're not reversing the process. You're not reversing the process. I had a gentleman, his numbers were always great. He was on diabetic medication. I kept telling him, hey, look, you're getting worse, you're getting worse. I did a cardiometabolic test on him 1 year. It wasn't too good. His sugars were still fantastic. Oh, my sugar's great, my sugar. No, you need to reverse this. He came back the next 6 months. We retested him. It was much worse. Is he having symptoms yet? No. But the thing is, why wait till you have symptoms before you reverse the problem? Why wait till you get a crisis before you do something about it? Really? Keys to defeating diabetes. 1, reversing the inflammation. And then when we reverse that inflammation, we need to control the insulin surges, because our insulin goes up when we have too much sugar in our system. The next, we need to help our body get resensitized to the insulin receptors. And then finally, we need to remove any food sensitivities. Identify, because food sensitivities cause inflammation. What's a food sensitivity? Food sensitivity is this. You guys have all heard of a food allergy, right? Food allergy, you take you eat food, it gives you hives or can't breathe or something. That's an allergy. Food sensitivity happens slowly over time. So if an allergy is a vase and you take a brick and you smash it, that's an allergy. A food sensitivity, you have a vase and you're hitting it with little marbles. And the marbles aren't strong enough to break the vase, but over time they keep putting little chips in the vase. And that's a food sensitivity, and it causes chronic inflammation. The next one, stabilize and repair the adrenal glands, because the adrenal glands have been stressed for a long time, and if you don't give the support to the adrenal glands so they to repair, you're going to have issues, once again, with getting your diabetes in check. So that's what we do, help build the building blocks for you. Types of negative stress, we said. What are the 3 types of stress we talked about? Physical, chemical, emotional. Physical, something like trauma, that kind of thing. Chemical stress. Chemical stress. What are some chemical stresses you guys know about? Smoking, too much medication, yes. Any others?
The air we breathe.
The air we breathe, pollution, alcohol. What about these guys? are these chemical stressors. It's artificial sweeteners. And I'm missing one, but you got the nice baby blue, the happy yellow, and what's the other color? Pink. You guys know it too. You guys know it too. I don't even have it, the pink one. Excellent. And the thing is, sucralose, this destroys your gut. The blue one, the pink one, saccharin. Saccharin causes all kind of joint problems. And aspartame, this is the absolute worst of all three. This is a neurotoxin. It turns to formaldehyde in your body. You guys know what formaldehyde is for, right? It turns formaldehyde. But yet, people consume these over and over and over, thinking that they're doing something great because it's not sugar, and it's worse than sugar. It's worse than sugar. And why do you think they make them these nice colors? They're attractive. They're baby colors. They're inviting colors. They should be black with a red skull and crossbones on them. These are pure poison. And not only that, who says they're okay to eat anyway? Who says they're okay to consume? The FDA. Who controls the FDA? The government controls the FDA. So if you're doing these, you cut these out, you're going to get rid of a lot of problems by taking these out of your system.
Even if you just eat one a day.
How much poison do you want? A little poison or a lot of poison?
That's cute. Yeah.
Just saying. All right. Emotional stress. And emotional, that happens to things outside of us. And most of the time it's relational, work-related, family-related, relational. What I help people understand, focus on those things that are in your control. What are things in your control? Well, first of all, have you guys heard of the prayer of serenity? The prayer of serenity? It says, God, grant me the serenity to accept the things I cannot change, the courage to change the things I can, and the wisdom to know the difference. And when you focus on those things that are in your control, most of the other things just really go away. What are things in our control?
Free will.
We can do what we want.
What we eat.
What we eat. Yes, Marianne, what we eat, put in our bodies.
Exercise.
Exercise. Yes, Sherry, exercise.
No more Coca-Colas.
Watching what we drink. Those are things that, how we respond to things. Those are things in our control. And once again, we focus on things that are in our control, those other things really just go away. There's missing pieces. So if you've been in a situation where you've tried to lose weight or try to get healthy and it didn't quite work out, it's not your fault because you've been missing some pieces. And I want to share with you what those pieces are. First, cleaning out your liver. I talked about your liver being bogged down, and if your liver is not cleaned out, it's going to cause some problems. That is not putting a hose up your backside. That's cleaning out your liver. Detox. Nutrition. Is nutrition important? Yes. Nutrition, so we need nutrition. Fitness. Is fitness important? Exercise? Yes. What about hormones? Hormones, are they important? They control a lot of things in our lives. Mentor. Once again, we need someone to help us move forward to get us to the goals and shortcut these things. Someone who have knowledge to help us apply the knowledge correctly. Missing pieces. What we do, we help people put these together in a systemized ABC 1, 2, 3 approach where that it fits together, you understand it, and as you understand it, you can apply it. And once you have the knowledge and apply it correctly, you can continue to use it for the rest of your life when it comes to your health. Because most people fail because they don't have a systematic approach. They're kind of looking over here for a little bit, and they kind of do something over here for a little bit, and they have to do something over here, and it's just not working together. Can we predict our health? Let's think about this. We know what we do. We know how much we do. We know what we eat, what we don't eat, what we drink, what we don't drink. We know if our health is getting better or worse. Can we predict our health? Can we look down the road and see where our health is going? If we like where it's going, continue. If we don't like where it's going, change and turn around. So we can predict our health. And we do that by doing the correct tests, not just tests that the insurance companies want you to get. We also focus on the cause, and we help fix the underlying problem, fix the dysfunction versus just fixing the number. And we treat the body as a whole. You're a whole unit. If you're missing one of those pieces out of your life, you're not going to be able to get optimal results. And a systematic 1, 2, 3 ABC approach with mentoring and coaching. With this system, you say, hey, Dr. Fryer, I would like to get on Dr. Fryer's Meet My Health Destination program. Which one of these pieces right here do you want us to leave out? If we leave one of those pieces out, what will happen? You won't get the results you're looking to get. I've shared a lot of information for you. We're going to help you understand and get better. Tell me, and I may remember. Show me, and I will remember. Involve me, and I will understand. I've shared a lot of great information with you guys tonight. Have you guys learned some things tonight? Yes. Your eyes are open on some things about our system. Of all the things I've taught and looking at the slide, what's the most important thing here? What's the most important thing here on this slide? Involve. Why is that important? Why is that the most important? It creates action. Yes, Brian. It's a participating thing. You're not going to be sitting on the sideline. There's actions that each of us have to take when it comes to our health. Because it's just not going to come by osmosis. We have to participate. And when you do it, you're able to continue to do it. Now you can say, well, I can just read about it. Well, if you read a manual on how to fly an airplane, do you feel comfortable getting in the cockpit and flying? It's going to take you a co-pilot or an instructor pilot and some other hands-on activities before you feel comfortable. So is it rocky at the start? It may be a little rocky as you change some things, but once you learn how to do it, it's easy. Because it's change hard, it's just different. It's just different. Don't want to be this cat. Because if you know something to do tonight and you don't do it, what's that called? Procrastination. We're looking for people who are committed versus just interested in their health. What's the difference between commitment and interest? Commitment is, hey, no matter what, we're going to make this happen. Interest is like, I'm thinking about it, it sounds good, but you don't get involved. So let's be honest with ourselves. Let's think about what we've learned tonight. Let's be honest with ourselves. How many are willing to make a commitment tonight to yourself, not to me, a commitment to yourself that you're going to take better actions in order to improve your health? Hold your hands up. I'm going to make sure everybody's hands working here. Right? Okay. Good.
She's committed to making.
And I wonder why. Great. The thing is this. It's a commitment. It's a commitment. And be committed to yourself. Be committed to your loved ones. Because they want you around. They want you around. Now, like I said, I was going to add, I've been talking to you for about an hour, a little over an hour right now. I'm going to ask for your permission to help you move a step further. Can I have your permission to provide that opportunity to sit down with me and have a conversation? Do I have your permission? Yes. Yes? All right, so I will stay, and I will, those of you who don't, dinner will be out. Thank you very much for your patience. Thank you for being kind to those around you, because I might be their last hope in correcting some chronic problems and turning their life around. What we're going to do, I'm going to sit down and do a complete wellness evaluation on you. It's going to start with a consultation. In that consultation, we're going to sit down knee to knee. It's not going to be any desk between us. I'm going to find out more about you and what you are going through day to day. I'm going to find out what kind of goals you have, health goals. And as I find out those health goals that you have, I'm going to help develop a blueprint so that you can get from an unacceptable position with your health to get to some of those goals met, whether it's traveling or whether it's having more energy or having a better sleeping pattern so you get restful sleep, whether it's losing some weight. We can help you do that. Now, I don't know where you are. I don't know what kind of goals you have. So I can't tell you all the things, but I'm going to be able to give you enough information tonight for you to be able to make a decision and move forward. That's what we're going to do. Next, we're going to look at a complete wellness evaluation. You're here. What do it takes to get you to here? We're going to do a blueprint or a plan of action for you. This is what it's going to take. It's going to take involvement. We're going to co-labor in this. This is not sitting on the sideline, and it's not pushing pills. All of this we're going to do. When you go to your doctor's office, how much time usually do you spend face-to-face? Now, I have some current clients in here right now. The current clients don't answer because I'm different. Those of you who aren't my clients right now, how long do you usually spend face-to-face with the doctor? 5 minutes, Michael? 5 minutes, Jewel? 5 minutes. The average is about 7 minutes. That's average. You spend 15, Lou? That's good. That's good. The average, the average in America is about 7 minutes face-to-face with the doctor. 7. And in that 7 minutes, how long do you usually wait before you see the provider? 45 minutes? I heard an hour?
Sometimes 2 or 3 hours.
2 or 3 hours? Is your time important?
Yeah.
You sure it's important? You're waiting 2 or 3 hours to see a doctor?
I waited 8 hours one day and the doctor still didn't see me.
Wow. And
No longer my doctor.
that's a good thing. That's a good thing. And the thing is this, yes, your time is important. But if you're waiting that long, my clients will rarely ever wait more than 15 minutes to see me. Rarely ever. Most of the time, it's on time, but rarely ever you're going to wait 15 minutes to see me. Because your time is valuable. You have better things to do than hang around my reception area and hang around my office. When you sit down for that 7 minutes, after you've waited for about an hour, what do you usually get at the end of that? A prescription. Then you got to go get that prescription filled. Is that an equal exchange of value? Waiting that time. Well, before we get there, how much is the charge for that visit?
$75, $100, a lot more.
75, 65?
You meant to the insurance company.
How much does the doctor charge for that visit? All right, let me ask it another way.
$40.
How much does the doctor charge for that visit? And the reason you don't hear much is because most people don't know. The average is anywhere from $250 to $300. Now, what the insurance cut, that's a whole other difference. But $250 to $300, that's average. Now, is that an equal exchange of value? Is that an equal exchange of value? No. No? Well, let's decide. Let's look at this. If you have to go in to see your doctor wait an hour to see your physician, to spend 7 minutes in the physician to get a prescription, and before you see them, you have to shell out $250 every time out of your pocket. Is that an exchange of value? Now, how much time have I already spent with you tonight?
Oh my God.
And how much have you learned more than what you've already learned in the past? So we're going to sit down with you. So to do this, to do a consultation, a wellness evaluation, and a plan of action, how much time do you think I should take with you to do that? 3 days. 3 days? Well, we don't have 3 days.
15, 17 minutes.
15, 17 minutes? Well, I'm going to do better than that. I'm going to sit down with you for about an hour. Sit down with you about an hour to do that. And you've already learned a lot. Now, as we build a blueprint for you, do you think you're going to learn a lot more? And then we help you how to apply that blueprint. How much is that worth to you? How much do you think I should charge for that?
$1,200.
$1,200? Well, that's the day I'm open. And the thing is this, I'm going to sit down with you for about an hour, and I'm going to charge you, usually the charge is $287. But because you guys are here tonight, and you've already invested your time, I'm going to take off $200. And the reason I take off that $200 and make it $87 is this. One, most of you in the room don't really know me very well. So I want to take that time to lower the barrier so I can help build trust with you to help you get to those goals. The second reason is, like I said, you've already spent about an hour, and so I don't have to spend that time educating you on the importance of what we do. And then why would I even charge $87 to start? Why would I even charge $87?
Because it's worth $87 for me to feel good.
Well, Cynthia, not only that, it's called skin in the game. Because a lot of times, if it's free, people don't value it. It's called skin in the game. I'm looking for someone who's committed. Do you think your health is worth that commitment? So that's what we're going to do. And if you are with a spouse or a loved one, and that spouse or loved one also wants to do a consultation, that spouse or loved one can come in for an additional $47. And even if your spouse or loved one does not want to do a consultation, even if they don't want to do a consultation, we do still ask for them to come. We ask for them to come, and this is why we ask for them to come. Now, Michael and Geraldine, you guys are married. Yes. And who decided to come tonight? Geraldine. So Geraldine, you came. Thank you, Michael, for your support. Thank you for supporting Geraldine. And Michael, when you came, did she have to drag you, or you came willingly? I came willingly. Great. So you care about Geraldine, right? You care about her health. Yes. So if Geraldine, when she comes in to sit down and have a consultation, will you be there? Oh, yeah. Why would you be there? To support her. To support her. We get the best results from people who are supportive, their loved ones who are supportive. That's where we get the best results. Because when you have that support at home, it goes a long way. And when people are working together, you're able to do a lot better in your health. So we ask for that person to come. Thank you. Spouse or loved one for $47. Imagine a time when you can get off medication and you can be free of going to the doctor's office. When you have the knowledge, the knowledge that you have now, you applying it, you can go leaps and bounds. But we want to help you build that blueprint to apply it to you individually. Help you understand how your body works. And not only that, but how certain things are affecting you. And if something is maybe coming on the horizon that you want to avoid. Imagine a time where you can travel and decrease some of the aches and pains that you may have. Decrease weight. Get off medications that are encumbering you and causing other problems. There's three things I want to share with you. First, there's three things I want to show you. First, we ask that you arrive on time. Ask you to arrive on time. I'm going to set aside an hour for you. We ask that you arrive on time. That way we have to take advantage of that full hour. Secondly, you're going to receive some paperwork. It's going to take you some time to fill that paperwork out, usually about 30, 40 minutes. We ask that you fill that paperwork out thoroughly. The more detail and the more thought process you put in that paperwork, the better evaluation we're able to give to you to provide where you want to go when it comes to your health goals. And then finally, if you have any lab values or anything like that within the last 6 months or so, we ask that you bring that because that will also help us evaluate where you are in your health. Three other things. 3 questions, 3 frequently asked questions. Then I'm going to take my mic off and I'm going to step in the back of the room to answer any private questions. But 3 commonly asked questions. First, does insurance cover wellness programs?
No.
Exactly. No, they don't. Why? Because insurance companies don't want you well. Is it affordable? Is it affordable?
Wellness program?
Is it affordable? The consultation? The consultation is affordable and the program's affordable. Most of our clients are single parents or on some kind of fixed income. We're able to make it work for them because they understand it. As they get the results and get rid of some of the things, they feel better because, once again, how much is worth your health? How much is your health worth? So it is affordable. The last thing, can we help everybody?
No.
No. Who can't we help? Those who don't want to apply themselves to the process. We aren't able to help them. So you guys have been fantastic. Thank you for your attention tonight. I thank you guys. We look forward to seeing your conversation. We're going to set aside the next couple weeks. Now, this is the thing. You need to commit, and as far as we ask you to commit, and it's $87 to reserve your slot. I'm giving 2 more next week. And if you say, oh, this is a good day for me, and you don't hold that spot, somebody else might take it. And the thing is, people are catching on to getting health. And we're very busy, so committing tonight, moving forward with us so that you can reach those goals you're looking to get, feel better, be able to do those things you're looking to do, get your health goals met. So thank you guys very much. Dinner's on the way. I'm going to take my mic off, and I'll be back to entertain any private questions. Thank you. Yes, ma'am.